So our topic tonight is, first of all, I'm going to do just a little bit of a national redistricting update. That landscape continues to change, and there's a lot happening there. So we wanted to just give you a little bit of an update on that. And then we're going to go on and introduce our special guest, Dr. Stacy Schmidt. And she is a co-author on an article that was just recently published about gerrymandering and health. And she's here local, and so we're real excited to have her join us today, and I'll tell you a little bit more about her in a few minutes. And as I said, we'll have a Q&A session, so please, as she's going through her presentation, or if you have any questions on the national landscape as well, put those in the chat as we go along. And then we're going to go over a few things about, where we're at and where we're going, some of the things that we want you to be thinking about as we go forward, working on this topic, and opportunities for you to get involved. So, as I said, I want to give just a little bit of an update here in terms of the national landscape. And this literally is changing. Oops, I went one too far, sorry. This literally is changing on a daily basis. And, no, I'm sorry, let me get back. Okay, there, now I'm on the right slide. This literally is changing on a daily basis. I had to check this morning to make sure there weren't any major changes versus what's on the slides here. But at this point in time, we now have 40 of the 44 states that are doing congressional redistricting completed. There are 6 states that only have 1 congressional seat. So those are not relevant to this particular statistic. But there are still 4 states that are outstanding, and you can see them in tan here as being in progress. Missouri actually did pass a map at the end of last week. I believe it's on Friday, and that is waiting for the governor's signature. So that's one that may be coming off of this list. But there are still 3 states left. All of them have court activity involved with them. And the other interesting thing that you don't think about when you're talking about these delays, or we need to think about, is what impact it has on the primaries. In all of these states, they're talking about either delaying primaries or having additional primaries. And actually, that's also true on the legislative maps. For instance, in the state of Ohio, they just recently had a primary the beginning of May, and they're going to need to have another primary for the state legislative districts that are still pending in court. So there's 46 states that have final legislative maps, and you can see the ones that are pending. And again, all of those are pending because of litigation activity. So this is a complicated chart. It is available on the Brennan Center with all of the detail behind it. But in essence, what this shows is the huge amount of litigation activity that is happening with redistricting this cycle. I don't have the numbers to compare it to 2010, but my sense is that this is much more significant than what we have seen in past redistricting cycles. There have been literally 70 cases filed in 25 states. Alleging, for the most part, racial and or partisan gerrymanders, and sometimes alleging both. Only in 6 of those states, though, has the court reordered a redrawing of lines prior to the 22 election. And you can see those states listed there. And those, again, for the most part, are the states that are on the kind of the delay list as well. And there are 51 cases that are pending, including the 5 cases that we have here in Georgia that we updated you on last month. So the other thing I wanted to mention is we had Michael Lee from the Brennan Center with us last month. And one of the questions to him was about the redistricting commissions and what we've seen across the country. And just to remind you, there are these number of states that you can see on the map here that have redistricting commissions. The true independent redistricting commissions are the ones that you see in red here. And most of those have been put in place by citizen-initiated ballot initiatives since the last redistricting cycle. So they were brand new in place for this redistricting cycle. Other ones that you see on the map here are various configurations. Some have both politicians and citizens on the commissions. Others are advisory kind of in nature. And overall, this is what, what we would say in terms of kind of the status of the commissions and how they worked this cycle. So again, the redistricting cycle was the first for most of the commissions, the true independent ones, but also many of the other configurations. Overall, looking back at the grading here, the average grade of a purely politician-made congressional map was a D, whereas that of a commission-made map has been a B+. So just on that factor alone, we can see that there's definitely an improvement from the use of independent commissions. All four of the states that got a grade, and these are the grades, same grades that we judged our maps on through the Princeton Gerrymandering Project, all four of those had commissions. The one caveat to that is that Virginia, while they had a commission, it was a combined political and citizen commission, and they ended up in a stalemate. And so the court had to intervene and have an independent map makers draw the map, but it ended up with an A map. The commissions with political participation, as Michael Lee said last month also, were rated lower, and most of them have been really mired in litigation. And you can see the three that were graded Fs. And these are both Republican and Democratic maps. So this is, we see with pure political drawings issues. So the bottom line is, again, true independent commissions were much more successful. They had higher grades on fairness, transparency, and opportunities for public input. And that's why we here at Fair Districts are still very interested in the idea of an independent citizen commission for redistricting. And the three that really are the benchmarks here, given that they were graded A's, are, and you can see their logos at the bottom there, Arizona, Colorado, and Michigan are definitely ones that we want to continue to study. So let's transition then. This slide, most of this slide we have used in past presentations with you, talking about the concern that we have about gerrymandering really undermining our democracy. Our concerns here are that every vote doesn't count equally. Incumbents just don't have a need to listen to all their constituents when really the primary is who they're playing to their base. They don't need to listen to a broader range of constituents than as they take office. It has led to really extreme partisanship and a lack of bipartisan problem solving. And as we showed with our split city analysis here in Georgia, counties and municipalities end up being split, and it's harder for leaders to even represent that district. My House district representative where I live, I believe has something like, oh, now I'm forgetting. Her district is 1 mile wide and 17 miles long, and it's something like 6 or 7 different cities that she is trying to represent. So that makes it difficult, needless to say. So, but then I went ahead and added here, because this really goes into then our topic for today. And that is around that areas that have strong public support, bipartisan public support, end up not being addressed as a result of gerrymandering, such as common sense gun control. And I put this on this slide before what happened here on Saturday. Reproductive rights, climate, and Medicaid expansion. And with that, we're really excited to have with us tonight Dr. Stacy Schmidt. Stacy is completed her undergraduate at Xavier University in Louisiana, then came to Georgia, to Atlanta, to complete medical school at Emory. and went on to complete an internal medicine residency program here as well. She is on the faculty at Emory School of Medicine as an associate clinical instructor of medicine. And she is also the medical director of the primary care center at Grady Memorial. Stacy told us, in fact, in a conversation we had earlier today about something else, how committed she is to underserved communities and to issues around the social determinants of health, and has done some very innovative things in terms of creating resident-based curricula to help train our next generation of doctors to have that same commitment and understanding of what it's like to serve those communities. She is a co-author of an article that was just published in Population Health Management. And as you can see, it is labeled Gerrymandering and the Political Determinants of Health. So with that, I'm going to stop sharing so that Stacy can start sharing and join us for this conversation. Welcome, Stacy.
Thank you so much for having me. And I am doing the share screen now. So hopefully you all can see the slides. Yes?
Yes, it's great. Thanks.
All right, perfect. Well, we will get started then. I thought we could start with just a little bit about me, and you kind of gave it away, Janet. So thank you. I want to start with just saying I'm a proud mom. I think mom and wife is as important to me as anything I'm doing in my life, but professionally, but I definitely see the blend and how one plays into another, and quite honestly, how thankful I am for the things I have in my life, because not every patient and not every person in Georgia or in our nation have those things. I graduated from the primary care internal medicine residency track and have been doing primary care as an official graduate since 2010. I cannot believe that much time has passed. And I work in an academic center. And so some of my job is direct patient care. And many of those patients I have known since getting married and having my first child, and I feel I know their lives as much as they know mine, which is the beauty of primary care, these longitudinal relationships and really getting to know people at a deeper level than you might in just a emergency room visit or a few day admission. But I also get to teach residents and really talk through them how to think about things from a broader root cause perspective so that we could hopefully prevent patients from coming back into the hospital. That's the ultimate goal, right? To keep them healthy, at least from my standpoint as a primary care and preventive health type of doctor. And I think because of that, I see so clearly how the places that a person may live, play, work, eat will impact their health. I'm from New Orleans, so we tend to eat to live there. Our food is rich and delicious, but also high salt, high calorie, and that plays into a lot of cardiovascular morbidity as a result. And so your environment is totally part of your health. And CDC even points out that about 70% of our health is related to those factors, and only about 30% related to what transpires within a clinic visit or even the prescriptions that you might receive. One other thing to know is this disclaimer, right? That I am not, while I will be presenting factual referenced material and data from reputable sources, including the CDC and medical journals, I probably also will state some views and opinions. And those views and opinions are strictly my own and not representative of any organization or institution for which I'm a volunteer or for which I work. And I think it's important to state that. So I'm hoping that by the end of this talk, you will have understood, at least through case examples, how gerrymandering affects health policy in our state. And that includes its impacts on exposure to environmental hazards within communities, eligibility for health insurance, particularly in the form of Medicaid, and then funding of public health agencies and policy, and so on. And of course, if it affects all of these things, we certainly don't think it should be ignored. And so I think giving a little bit of a lay of the land and speaking a little bit about terms will be important before we really dive in. I wanted to touch on the term political determinants of health, because I think gerrymandering, as well as voting and government participation, which results from voting, and then policy making, which results from the politicians that we elect, these are all forms of political determinants of health. And because gerrymandering impacts all of those, it in turn is a political determinant of health, potentially one that's even further upstream than voting, government participation, and policy making. And these political determinants of health are basically systematic processes of structuring relationships so that resources are distributed in certain ways and power is really administered in certain ways. And these systems really reinforce and influence each other and ultimately shape opportunities within communities. School zoning being one example of this. And again, as I think about how I have been blessed to live in the neighborhood that I am in, I'm constantly thinking about these political and social determinants and how they impact my life, but also the lives of my patients. I'll never forget hearing an NPR episode actually, where I strategically wanted to live in a neighborhood that had a big tree canopy. Aesthetics and nature is just very important to me. And I just love the look of these neighborhoods. And I always felt like when I drove in certain areas of the city, suddenly there were no trees. It just felt like a bunch of concrete, very industrial, and it just didn't look as pretty, if you will. Well, it turns out tree canopies are located in more and well-resourced and financially better areas of the city. And it makes total sense because it costs tens of thousands of dollars to actually cut and trim these trees. Lo and behold, neighborhoods with tree canopies have better health outcomes. During summer months, those neighborhoods that don't have tree canopies, which tend to be less resource neighborhoods, neighborhoods with less employment opportunity and lower income, have higher rates of heart failure exacerbation during summer months, simply as a result of it being hotter in those neighborhoods, and so on and so forth. So policy, right? The decision to allocate funds to have green space in a neighborhood impacts health. And I think these are just great examples that help you to understand how political determinants play into health for our patients. States, okay, so let's talk a little bit about then redistricting and the census, just again to get a lay of the land, right? Every 10 years we have the US Census, and that data helps to draw redistricting lines to account for population changes, also to make sure that the legislatures represent about an equal number of people within each district. And ideally, that the district reflects similar beliefs of the communities served. But what we know, right, is that partisan gerrymandering is an attempt to manipulate the districts to support the party in power such that they continue to be reelected. And not only that and we'll talk about this when we describe severe gerrymandering, not only that they get reelected, but that potentially they earn more and more and more seats within the state legislature. So at its basic level, gerrymandering involves packing and cracking, where they pack constituents who are likely to vote the same into a small number of districts, which are full of those constituents. And then among the rest, they crack the constituents such that the voting power is diluted and they can't vote for the other party within those districts. And one example of where this actually cracking in particular, diluted the voice of the community is in the neighborhood of Watts, a historically Black area in Los Angeles. It was split into so many districts that when a hailstorm hit the city in 2003, the residents did not know which representative represented them and who to go to. And it got to the point where even the representatives were confused and would send the resident to another representative who said, no, it's not me. You need to try so-and-so. And it basically led to no representative or council person feeling ownership for this community as a whole. And also the residents no longer had an avenue for advocating for the resources that they needed. So I just want to kind of point this out then. Partisan gerrymandering, in effect, results in the party in power staying in power. And basically this occurs by redrawing or the maps such that the official is pretty comfortable that they're going to become reelected. In some cases, very comfortable. And when you're that comfortable that you will become reelected, you are no longer thinking in terms of, well, what are my voters going to say and what do they want? Because you already know you have the votes. So what it really allows then is for the elected official to choose policy that fits in line with their ideology rather than the voice of the people. And that can lead to extremes in ideology and extremes in health policy rolled out, right? So if you leave with nothing else, I want you to leave with these take-home messages thus far. Extreme partisan gerrymandering dilutes the voice of the people, and it leads to the party in power staying in power, and it usually leads to even more and more representation of that party within state legislatures. This results in our elected state officials not feeling accountable to the needs of the community as a whole. And then it leads to them making decisions based on their ideology rather than the voice of the people. And I place no blame here, because if I had a magic wand, I'd love for the world to go exactly how I think it should. But the importance of a democracy is to reflect the voice and the will of the people. So extreme gerrymandering. So as I've described things thus far, you're probably thinking of gerrymandering as more of a policy or a construct for creating super safe districts so that a person knows they're going to get reelected. But believe it or not, extreme gerrymandering is actually a little bit more under the radar and a little bit opposite of that tenet, if you will. With extreme gerrymandering, which actually occurs in battleground states, not in deeply red or deeply blue states, they've already got it, right? Extreme gerrymandering tends to occur in battleground states where they're trying to disperse just enough of the population to win multiple districts and thus gain control of the state. And so how do we uncover it, right? And I'm sorry, let me just point out again that every seat matters in this scenario, that when you have a state legislature that is so largely Democratic, for example, you can pass very liberal policies and not worried about it not getting approved, right? But if you are in a state legislature where you have, even if you do have majority Democrats, but there are a solid number of Republicans, some of those moderate Republicans could make the difference between your bill being approved or not. And so every seat in the House, every seat in the Senate at the state level matters. So how do we uncover it? If extreme gerrymandering is a little bit more under the radar and more about dispersing just enough so that you can win multiple districts, then how on earth do we uncover it? And I think I've learned through doing work with Fair Districts Georgia and Fair Count Georgia and had the pleasure of actually drawing my own community map. I cannot tell you all how thrilled and inspired I was by that opportunity to feel like I had a voice and was contributing to the process. But basically, by having your community speak and do this, and by having computer simulations that create thousands of these maps at random, you can pretty much see when there's a big outlier. And once that big outlier has been determined, courts can then look into other evidence to say, well, why is this an outlier? Was this intentional? And they may look at legislative materials, floor statements by lawmakers, emails, so on and so forth, to say, hey, this map was drawn outside of neutral considerations. So I think this all begs the question then, is Georgia participating in extreme gerrymandering? Well, I am not a statistician or an analyst, so I won't say yes or no. I will simply present the facts. And the facts are that in 2017, at least per Gallup, a Gallup poll, party affiliation in Georgia gave Democrats a 2-point advantage. Affiliation was 42% Democratic and 40% Republican, and that really made Georgia a competitive or a battleground state. Compare that, however, to the state legislature, which is largely Republican at both the Senate and the House of Representative level. And I'll let you decide if you think that constitutes extreme or severe gerrymandering. Lucky for us, we also have the Princeton Gerrymandering Project, which are grading these maps through these computer simulation models. And so with time, I think we will have more data support to really make this case for us without us having to assume. So now that you understand a little bit of the lay of the land, let's look at some examples by which gerrymandering impacted exposure to environmental hazards. With Flint, Michigan being a great example that I'm sure you all are familiar with. What I didn't know was that in that process, gerrymandering played a role in the situation as it unfolded. Flint's community voted against the ballot proposal for the state appointed manager to handle municipal services. They did not want that. I think they probably knew if it's done at the state, our voice will not be heard. And the gerrymandered state legislature overrode the vote. Didn't really concern themselves with what the people voted on and gave this state manager control of the services. That manager subsequently directed the community's water supply to flow from the contaminated river. And of course, it led to lead poisoning and deaths among multiple people. What we also know is that research from the 1980s and the early 2000s shows that about 60% of African Americans reside near an unregulated toxic waste facility. And so Kramer and colleagues actually analyzed minority demographics in connection to these Superfund sites. Superfund sites really just refers to toxic waste dumps, basically areas that the EPA has said there is an issue here and Congress is going to have to come up with the funding to fix it. They're either going to have to fix it themselves or fund us to fix it. And so that's where the term Superfund site came into play. So they basically said, okay, well, next to these toxic dumps, are these communities more minority or more white? What's it looking like? And as you get further and further away from these toxic waste dumps, do the demographics change? And also, does the geometric complexity of the congressional districts as these maps are drawn, do they change as you get further and further away from these toxic waste dumps? And they basically said, we're gonna use congressional district complexity as a proxy for gerrymandering. I don't really know what congressional district complexity means. I would love to dive deeper, but I'm assuming it means how complicated did this map look compared to the community in which it served? And they basically discovered that the further you got from the Superfund site or the toxic waste dump, the more white the communities became. The closer to the dump, the more minority communities were located. And what they also noticed was that the further away, the geographic complexity of the congressional districts changed the further away you got from the dumps, essentially leading to the conclusion that that minority groups were being gerrymandered out of white districts and low hazard districts and gerrymandered to be closer to the toxic waste dumps. Or I wonder if the converse is true, that as a result of gerrymandering leading to some districts being very well resourced and other districts having the more marginalized communities, that decisions of where the dump would then be placed happen kind of after the fact. It's hard to know chicken or egg, but in any circumstance, it seems that there is correlation. So median income, the authors did point out that median income and unemployment could also explain the variance that they were seeing. But that's unfortunate as well when you think about the fact that through systemic policies, minority individuals and communities have been more affected by unemployment, poverty, uninsurance, and so on. And redlining is a great example of that, right? The denying of mortgages or intentional undervaluing of homes according to your race. And what we know is that home ownership is the biggest source of wealth accumulation and passage among generations within the United States. So by denying minority communities access to home ownership, you not only are affecting the family in that present day, but the generations that are going to come after that family with the wealth that they hope to pass on to their offspring. And unique in that it suggested a deliberate effort to marginalize, whether it can't say for sure whether it was intended to marginalize minority communities, but it certainly seemed to be affecting impoverished communities, which through these systemic policies have historically been minority. So gerrymandering also has impacted, at least extreme gerrymandering, access to healthcare. And that's particularly, I'm speaking from the form of Medicaid eligibility. So I wanna, I'm gonna try hard to focus on Medicaid eligibility because it upsets me that Medicaid expansion has been such a hot topic that as soon as you say the word, depending on what your political divide may be, you're immediately going to be in favor or against. Really, I'd rather avoid terms that are triggers for us and to simply say Medicaid eligibility. We are simply trying to make more people eligible for health insurance. And what we saw was that with the passage of the Affordable Care Act, that states that had very extensive and severe GOP gerrymandering showed more opposition to Medicaid expansion. Again, it became such a political hot topic, right? Whereas states with more balanced and partisan legislative chambers had better chances of extending Medicaid. Now, what does this mean? This means if you have a Republican governor, a Republican Senate, and a Republican state legislature, the odds of increasing Medicaid eligibility are very, very low. If you have perhaps a Republican governor with a Democratic state Senate and a Democratic House, you might be able to do that. And certainly if the entire legislature is Democratic, things seem to go swimmingly as it relates to Medicaid expansion or increasing eligibility. And so this graphic really just states that. It's looking at the degree to which Medicaid did not expand in states, and basically states that had full Democratic control, right? They did not deter expansion at all. States that had divided control, where maybe the governor was leaning one way, the state Senate was leaning another, they blocked or at least challenged the ACA 28% of the time. States with GOP control, so complete, governor, state Senate, and state legislature, challenged the ACA or did not expand 65% of the time. But then states that were Republican entirely, governor, state legislature, and House, but extremely gerrymandered, meaning the state legislature had a huge majority of Republicans and there wasn't as much of a balance, almost unanimously did not expand Medicaid. And that is in spite of the fact that in non-expansion states, the majority of people, the voters, want access to Medicaid and want to be eligible for it. So again, it kind of shows that when this extreme gerrymandering occurs, the ideology of the elected official supersedes the will of the people and what the majority of the voters want. And this is, in my opinion, a travesty because Medicaid eligibility is helping a lot of Americans. Shouldn't say the majority, but a lot of Americans. And just to understand what expansion or increasing eligibility means, basically Medicaid has always been for low-income persons, but it actually was only for low-income persons who were either pregnant, elderly, or with disabilities, or they had children of young ages. With expansion, or by increasing eligibility, it basically included those adults who were not elderly and weren't pregnant or with children, single adults, single young adults, your average 20, 30, 40, even 50-year-old walking around, right? Who could get hit by a car tomorrow, or I can't tell you how many 45 and 50-year-old people I have known, maybe not known, but I knew the person who knew them who have died from a heart attack this year. It feels a little out of the norm in my mind, but these things can hit anyone of any age. And Medicaid expansion really includes those persons, and it increases the eligibility from 100% of the federal poverty level to 133% of the federal poverty level. So this is just a pictorial to kind of say the same, right? That it historically covered persons with disabilities, families with small children, pregnant women, but not single adults who didn't meet any of those criteria. We are expanding to include those, but we're also increasing the federal poverty limit by which you can be eligible. So I'm going to pause for a minute because I've already talked a lot. And just open it to the group or to the chat. And guys, I'm not going to fiddle with the chat because I will confuse my screen. So I may let one of you speak out what you're seeing, but
I'll do that for you.
Perfect, Janet. I'd love if the audience wrote into the chat for a family of 3, what income you think 100% of the federal poverty limit is in 2022. What income is that family of 3 bringing in? And I'd love for you, and if you know the answer, don't write.
40,000.
40,000.
Joseph
Okay.
thinks, yep, 30,000. 45,000.
All right. So you're not saying anything, so there may be a low. And my question to you then
55,000.
is 55,000. Okay. Of the values written in, just write yes or no if you think that it is enough income for a family of 3 to support roof overhead, food always on table, transportation, medical bills, and I had one other, utilities. Thinking about your
We have a
own
lot of
income.
no's, and we have Joseph has a hell no.
I like the hell no. All right, well, perfect. So you all were not too far off, but everybody, if this were Price is Right, we would have all lost because we overbid. So for a family of 3, 100% would be 23,000. And 133% would be 30,000. So for those who picked the 30,000, if we had expanded Medicaid in the state of Georgia, we would have at least allowed that family to be eligible. So thanks for playing that little game with me. But what we know, right, is in states that have expanded or increased Medicaid eligibility, that various health outcomes have improved, including the diagnosis of early stage cancers, and then including improving medical debt, because now you're not waiting until you're at death's door and you need an emergent surgery and a 3-week hospital stay. It improves access to mental health services, which goodness knows we need in this day and age, and greater use of primary care services. So what that means for me is you're going to actually get your colonoscopy, you're going to get your mammogram, you're going to get all the vaccines that you need, assuming you are open to receiving vaccines, to stay healthy and not become ill. And so in my mind, prevention is key. But if you don't have health insurance, the odds that you're coming in and paying out of your pocket to receive those preventive services are slim to none. Oops, excuse me, I skipped the slide, I believe. We know that Medicaid eligibility, increasing eligibility to those at the 133% federal poverty level, improves access to care according to race, income, education level, and employment status. Across all those spectrums, access to care is improved. It's not just across somebody who doesn't have a job or only this demographic. It really helps across all of these levels. And additionally, infant mortality declined. So why is that important? Because Georgia is not doing very well by way of infant mortality, right? So the more red and dark these states are getting, the worse the infant mortality. And Georgia's right here at the 7 to 8 infants per 1,000 live births who are dying. Where do you think we rank by state? 1 being the state with the best infant mortality, number 50 being, or really 52 here, because I think they included Puerto Rico and DC, I believe, as separate. Where do you think Georgia fell? Throw it into the chat and rank. No cheating, no Googling.
35th. We have 148th, 49th, 43rd.
You all are good. We were at 44. So definitely closer to the not so good side of things than the good side, not even at average. And yet we know that increasing eligibility for Medicaid can improve this metric within our state. Additionally, increasing Medicaid eligibility protects rural hospitals from closure, increases jobs, because now you have hospitals opening, you have health systems that are willing to come into your state because they know that hundreds of thousands of people are now eligible. So it increases the job market, which then increases revenue to the state in the form of state taxes. And so states tend to benefit as well. And Georgia, of course, has suffered its fair share of rural hospital closures recently. And the causes for this are many. COVID, definitely put a strain on hospitals, but the decision to not expand has played a role into this as well. If we were to increase our eligibility to 133% of the federal poverty level, we would have insured about 450,000 non-elderly people, or at least they would be eligible for coverage. And that's about 39% of the state's currently uninsured non-elderly adult population. So how have our politics played into our decision to expand or not expand? I find this so interesting that when Governor Deal stated he wasn't going to expand, things were fine. But when his term was coming to an end, the legislature decided that worried that a Democrat might be elected governor, they quickly passed a bill ensuring that expansion could not occur until there was legislative approval from the state and the House. But once Kemp won, they quickly reversed course and gave discretion to the governor again to make the decision about expanding or not expanding Medicaid. And so it again plays into this, what is the balance of power within your state legislature and within your, across these, between governor, Senate, and House. So yet another point to make is how gerrymandering can affect health policy. And actually in all of the examples I've already given, it's really showing how it affects health policy. But I also just wanted to make the case in the way of COVID, which is that heavily gerrymandered states, particularly when they're gerrymandered towards the GOP, and I feel like I'm targeting the GOP right now, and I want to make it clear, you stated it so nicely, Janet, that gerrymandering occurs across party lines. It just so happens that in this scenario, when we're talking about Medicaid expansion, that tends to be a hot topic for Republicans to not be on board with. And so in that scenario, heavily gerrymandered states towards the GOP have demonstrated lower legislative response to the pandemic, in part related to ideology. And that relates to expanding access to telehealth services, transparently sharing COVID-19 data, providing grace periods for insurance premiums, so on and so forth. And so I just come back to this again, just a reminder, right, of what we're talking about here, that when ideology trumps the voice of the people, and when the legislature doesn't represent the demographics and political makeup and values of the state, then you can subsequently get certain people elected who may not be thinking about, well, what are my voters wanting? And that, of course, leads to policies that are not necessarily reflective of the state or of what the people may need. So where do I think we can go now that we've kind of talked about these things? I think there should be more proof of concept. So we talk about using the Princeton gerrymandering scorecard to define heavy gerrymandering. How is there just a yes or a no? What defines extreme gerrymandering versus just a little? And to what degree on that spectrum are we seeing this divide in the form of Medicaid expansion? And I just like that particular topic because we already have robust data showing that expanded states do in fact have better health outcomes. So it just seems, it begs the question that if we can show or somehow uncover that extreme gerrymandering plays one way or another into that we have a more more suggestion that that gerrymandering is really impacting health, right? And I'd love to know that in both directions. Of the states that were heavily gerrymandered Democratic, did they go one way always? Of the states that were more heavily gerrymandered towards the GOP, did they always go one way? And to what degree and spectrum did that occur? But then even within our own state, I'm just going to jump to the next slide because I loved seeing this from Fair District, Georgia. They were like, here are our winners for the most cracked cities in Georgia. And so I would just be interested in looking at some of these cities that have been heavily cracked and kind of looking at, well, how are health outcomes and how was healthcare utilization prior to this community being cracked and then after the community was cracked. And that requires longitudinal data, right? You're talking about looking at maybe 10 years prior and then 10 years post, but did health outcomes change? And pairing that with qualitative studies, talking to the community members, what do the long-standing ones, what changed in policy or in other makeup of this community that seemed to play into health outcomes and how they changed? And then, of course, I think most importantly, we're really just talking about balancing political representation to reflect the values, the demographics, and the beliefs of the people. That's really what we're getting to. And it just comes back to what Janet brought up about this idea of creating an independent redistricting commission that really takes out redistricting from the partisan legislature and focuses on achieving true balance to reflect the people it's representing. And that we really, when maps are drawn, whether it's through an independent commission or through the state legislature, that it's transparent and accountable and allows community members to come to the table and say, hey, I'm seeing this map and it is not quite matching with what I think of in my community, and here's why. But I think we also, not only do we need to have this transparency and the ability for the community to come, but we need to go to where our most marginalized groups might be, or where we need to go to people who may have barriers to coming to us, is what I'm saying. And whether that's people who don't speak English as their primary language, or who might be hearing impaired, or the poor mom, dad, uncle, kid who's working 7 a.m. to 7 p.m. Where is their voice in this? How do we come to them to hear their voice in this matter as well? And so with that, I am going to stop sharing and turn it back over to Janet.
Okay, now I was having trouble unmuting. Sorry about that. Well, thank you, Stacy. Now everyone can see why we were so excited to have you with this program this evening, and on a topic that's especially near and dear to my heart, having worked in Medicaid literally almost my entire career. So we have lots of positive comments in the chat. We don't have a lot of questions in the chat. So I'm going to ask a couple, and then I'll give you time maybe to either put them in the chat, or we've got a little bit smaller group tonight. We might ask people to raise their hands, and we can take some questions live. We'll have time for just a few questions. One of the questions, Stacy, that Beth Stevenson asked is, she said, some redistricting efforts are looking at creating maps that reflect communities of interest. We hear that a lot in the redistricting world. She is wondering if creating communities around health and social issues might be an approach. Your thoughts on that?
I love that approach. I mean, I am biased towards it, but I do love that approach. And I think, you know, one community that I know Fair Districts Georgia has brought up is the Beaufort Highway Corridor. And I've just kept that in mind once I heard that this is a community that is, and correct me if I'm wrong, Janet, my understanding from what has been said is that they've never really had a voice. They've always been split into multiple districts and felt unheard. And so I'd be very curious to know, what are the health problems and outcomes that they are experiencing that they have wanted to see change or been advocating for, but because they have no voice, they haven't been able to see change? And how do you bring that to the forefront to perhaps think about how is this community, what do maps need to look like for this community to have a voice in political will.
Mhm. So, and we have a lot of comments in the chat about the Medicaid expansion piece, and thinking that obviously who we elect matters. And so there's definitely some comments about that, but also about, you know, how to educate our legislators about all these issues with Medicaid expansion. Other thoughts you have related to that?
Oh, I ponder this often. I mean, I have to say, I'm a Libra. Anybody in the group of Libra? If you are, you know, we hate conflict. We're constantly thinking about justice and equality, but we also hate conflict. And I am a big believer in how do we just bring as many people to the table as possible. And I know it is so hard. And I've often thought about paradigm shifts. Okay, if when you hear the term Medicaid expansion, it just completely turns you off because it's been such a trigger. How do we talk about this in a different way? Making sure people get eligibility for health insurance, making people healthier. However, we need to reframe the language so that it's not so off-putting. I think we need to think about that. And I think it has become so polarized now that people don't even know what it means. My learners don't know. Without us talking about it, if I just walk into a room and say, describe to me what Medicaid expansion is, I don't think that half of my learners could just off the cuff say, oh, it means people who went from 100% to 133% of the federal poverty level are now eligible. I didn't even understand the gist of it being, oh, single adults who don't have children and who aren't elderly. This is the group we are specifically talking about. So I think it's become such a term that triggers that people have stopped even wanting to know or understand what it really means. And so we need to just get to the basics of what are we really talking about here. I just want my single child who now turned 26 and can't be insured under me to have some health insurance. That's all I'm asking for.
Yeah, I think back to my own experience. I was very involved in advocating for Medicaid expansion in the state of Ohio. And despite a Republican governor and Republican majorities in both of the chambers, we got it done. And that was in large part because of appealing to the need around mental health care. And Governor Kasich has a brother that has serious mental health issues, and he embraced it. And we got it done. And this last session here in Georgia, we saw a bipartisan effort to, to address mental health care with a lot of patchwork of different things with state funding. And I know that Medicaid expansion probably could have done a better job actually of addressing the need for mental health services in Georgia. So somehow we have to get over that piece. We have a hand raised from Margaret Blackman, who is one of our stellar volunteers here at Fair Districts. Margaret, if you can unmute yourself, hopefully you can, and ask a question.
I thank you very much, Stacey. You are outstanding. And I think that one of the things we should do is to expose the amount of money that our governors have spent trying to get something else. They're trying to take federal money, but not follow the rules. And I'm quite sure it's in the millions that we have spent fighting against the federal regulations. And I mean, if we'd taken the money in the first place, I think we'd be far better off.
Good point, Margaret. Well, with that, I know we just have 3 minutes left, so I'm going to just close us out. And again, thank you so much, Dr. Schmidt, for joining us and for being part of our Fair Districts family here. We're going to definitely be tapping you for some issues around this as we continue to go forward and advocate for redistricting reform here in Georgia. So let me just finish us out here with our usual kind of last pieces. Okay. Okay, so what's next? And these are some things that are things that you can get involved with now, or as we go forward. These are areas that Fair Districts is focused on. First of all, and we talked about this in much more detail the last couple of town halls, and that is the ongoing litigation. We believe that, or we know that all those cases will be coming up in after this election, after in 23, and so we'll continue to be involved, as we did with the amicus brief that we filed in the case that was heard earlier this year. Also, a reminder that local redistricting, as we're calling it, phase number 2, is really underway now and will be for the next probably 9 months or so. And that is all of our municipal districts. So what happened in the legislative session this year was focused on counties and school districts, county school districts. And the next phase that is impacted are our municipalities. So our cities, our other school districts that are associated with cities or independent. And those will come up for review over the next months in order to be ready for the 23 municipal election cycle. So again, you can access our toolkit and be starting to think about asking your city councils, other municipalities that you live in, what their plan for redistricting is, and to ensure that there is a good, robust public process along with that. We are going to be launching a project here after the primary to ask all of the candidates in the 22 general election to support fair redistricting and to complete a candidate pledge. So we will be giving you more details on that over the next 6 weeks or so. But in the meantime, if you go to candidate forums, start asking that question. Where do you stand on redistricting? What can we do to have a more fair redistricting process here in Georgia? We want candidates to know that the public is concerned about this. We will continue to be watching for and need your help to prevent any kind of mid-cycle redistricting in this next legislative session. That'll be particularly an area of focus. And we are really preparing, and we've looked at some data analysis around this. We're preparing for what we think is coming here in Georgia, which is a tipping point, and may provide more of this balanced kind of government that Dr. Schmidt just talked about, and may be an opportunity to pass redistricting reform, including advancing the idea of an independent redistricting commission. So this is not just waiting till 2030. We really need to take advantage as soon as that political environment is there to try and advance our reform agenda. We are also working on a project to do a public poll in order to show our elected leaders that the public here in Georgia wants to see that redistricting reform. So that will be coming here in the next couple of months as well. And then continue to join us here at our monthly town halls. Our next one is scheduled for June 27th. We did this one a little bit earlier, given the Memorial Day holiday coming up, but the next one is on June 27th at 7 p.m. And again, a reminder that we appreciate your financial support. This is an all volunteer organization, and we continue to try and punch above our weight, as our chair would say, and that takes some funding to be able to do that. And we will be putting an evaluation link here in the chat and also sending it out with a thank you after this program. Your comments on the program are always helpful for us so that we can continue to bring you hopefully valuable information in these monthly town halls. And if there's any topics that you're particularly interested in learning about, also put that in the evaluation. And with that, I think we are done for the evening. We really appreciate you joining us. And again, our thanks to Dr. Schmidt for providing us such thought-provoking information related to this very real issue about how gerrymandering impacts us here in Georgia. Thank you. Have a good evening.